right, let's dive into something, well, a little awkward. Hemorrhoids.
Yeah.
I know.
Yeah.
Not exactly dinner conversation.
Right.
But hey, it's super common. We're going to break it all down, like what causes them, what to look out for, and most importantly, what you can do about it. We've gone through tons of research, medical texts, even some interesting FAQs. We are going to get to the bottom of this, literally.
It is fascinating. Hemorrhoids are so common, yet people get so embarrassed to talk about them. Hopefully we can change that.
Right. No shame in the hemorrhoid game, as
Mm.
they say. Or maybe they don't say that,
Maybe not.
but they should. So let's start with the basics. What are hemorrhoids, really? I mean, yeah, swollen veins, but what's the deal with them?
It's all about pressure.
Yeah.
Think of the veins in your lower rectum and anus, like these tiny little balloons, and anything that increases pressure down there, like straining, pregnancy, even sitting for too long, it makes those balloons inflate. And when they get too big, hemorrhoids.
Okay, that makes total sense. But here's something I've always wondered, like, why do some hemorrhoids hurt like crazy and others, you barely notice them?
Location, location, location. Internal hemorrhoids, the ones inside the rectum, don't usually cause pain. There are fewer pain-sensing nerves in that area. But external hemorrhoids, those are under the skin. Lots of nerves there, so you feel it.
So like stubbing your toe versus bumping your elbow, same injury, different pain level.
Exactly. And then there's that thrombosed hemorrhoid. Blood clot forms. Ouch. Those are the ones you'll definitely feel. Might even need to see a doctor for those.
Okay, I'm starting to get the picture here. But let's talk pregnancy, because it seems like every pregnant woman I know has dealt with hemorrhoids. What is it about pregnancy that makes them so common?
Well, think about all the changes happening. Increased blood volume, hormones shifting, and then there's the growing baby putting pressure on, well, everything, including those veins in the pelvic area.
So it's like a perfect storm for hemorrhoids.
Yeah.
Makes sense why they're so common during pregnancy, but it's not just pregnant women, right?
Mm.
What are some other common culprits we should be aware of?
You're right. Pregnancy is a big one, but it's not the only one. And you know what? One of the biggest misconceptions is that this is an older person's problem.
Oh, really?
Absolutely. They can affect anyone, even young, healthy people. And studies actually show that people with desk jobs, they're more prone to hemorrhoids than people with more active jobs.
Wait, seriously. So all those hours I'm sitting here recording this, that could be putting me at risk. Okay, now I'm motivated to stand up. But you said misconception. What are some other myths about hemorrhoids?
Oh, there are plenty. For example, some people think spicy food causes hemorrhoids. Spicy food can definitely make things more uncomfortable if you already have them.
Right.
But it doesn't cause them. Another one, weightlifting.
Oh, interesting.
Yeah. It's all about proper form. If you're straining, yeah, that's a problem. But the weightlifting itself, not the issue.
So spicy food, weightlifting, not the villains we thought they were. It always comes back to that pressure. But how do you know if you have hemorrhoids? What are the signs?
Well, sometimes there aren't any, especially with those internal ones. But a big one, bright red blood. On the toilet paper, in the bowl, that's a sign. And then there's pain, especially during bowel movements.
So if you feel like you're passing shards of glass.
Yeah, that's a pretty good indicator that something's not right.
Yeah, I'd say so. What about more subtle symptoms, though? How do you know if it's just like a bad bathroom day or if it's something more?
Itching and irritation, especially with those external hemorrhoids, are pretty common. You might also notice swelling, maybe a lump in the area, and sometimes there can be mucus discharge.
Okay, bleeding, pain, itching, swelling. Not exactly a party down there.
Hmm.
And I'm guessing ignoring those symptoms can lead to some pretty nasty complications, right?
You're right. Hemorrhoids can progress. There's actually a grading system from grade 1 to grade 4. The higher the grade, the more likely you are to experience complications.
So early intervention is key. But what does that mean exactly? Let's talk treatment options.
Before we jump into treatment, it's important to understand how they're diagnosed, which is usually pretty straightforward.
Oh, thank goodness for that. So what does the diagnosis involve?
For external hemorrhoids, a visual exam is usually enough.
Okay.
But for internal hemorrhoids, the doctor might need to do a digital rectal exam.
Okay, I know this is a delicate topic, but let's be real. A digital rectal exam. That sounds a little uncomfortable.
I know. But it's quick, relatively painless, and it's the best way for the doctor to check for those internal hemorrhoids and see how severe they are. They might also use something called an anoscope, which is a small, lighted tube, so they can get a better view.
So it's all about getting a clear picture of what's going on down there. But let's get to the part everyone wants to know about. Treatment. What can you actually do about hemorrhoids?
This is where it gets interesting. And thankfully, less scary than a digital rectal exam. The good news is, most hemorrhoids can be managed with simple lifestyle changes and some over-the-counter remedies.
Okay, that's reassuring. So before we get into all that, let's dive into those home remedies and lifestyle changes, and then we'll explore what to do when those just aren't enough.
All right. Let's talk solutions. For a lot of people, just making a few changes to their daily routine can make a huge difference in managing hemorrhoids.
Okay, so get practical. What are some of those top lifestyle changes? I'm guessing diet and exercise probably play a big role.
Absolutely. Let's start with the MVP of digestive health, fiber. Fiber is like a superhero. It makes your stool softer, bulkier, which means you're not straining as much, less pressure on those veins.
Right, fiber. We hear about it all the time, but it's easy to fall short. What are some simple ways to boost fiber? I'm picturing bowls of bran cereal. Hopefully there are more appealing options.
Oh, for sure. Bran cereal is a classic, but there are so many delicious ways to get more fiber. Berries, avocados, lentils, almonds, they're all packed with fiber and they taste amazing.
Okay, that's way more appealing than I imagined. So, upping our fiber game. What else? I've heard staying hydrated is super important for digestion. Does that apply to hemorrhoids too?
You bet. Water helps keep everything moving smoothly through your system. You get dehydrated, your stools get harder, drier, which
Well,
means...
training.
Exactly.
No one wants that.
Oh,
Okay,
so
fiber, hydration. What about exercise? Does getting those steps in help with hemorrhoids?
exercise is fantastic for overall health, and that includes digestive health. Being active can help stimulate bowel movements and prevent constipation. Even a brisk walk every day can make a difference.
Just basically move that body. I
Yeah.
like it. It's amazing how so many health issues, they just come back to those basic principles. Eat well, stay hydrated, get some exercise.
It's true. Taking care of your body goes a long way in preventing all sorts of problems, and hemorrhoids, no exception. But even with the best lifestyle habits, sometimes those pesky hemorrhoids, they still show up.
They do.
And that's where those over-the-counter remedies come in.
Okay, let's talk about those. What are some of the most effective things for finding relief? Because I've seen a ton of creams and ointments at the store. Like, how do you know what to choose?
You're right, so many options. One popular ingredient is witch hazel. It's a natural astringent, so it can soothe and shrink swollen tissues. Another common one is hydrocortisone cream, which helps with inflammation.
So, witch hazel for soothing, hydrocortisone for inflammation. Got it. But what about those warm sitz baths I've heard about? Are those just an old wives' tale, or do they actually help?
Sitz baths are definitely not a myth. They can be incredibly soothing for hemorrhoids. The warm water just helps relax those muscles in the area, promotes blood flow. It can really reduce swelling and discomfort. And honestly, it just feels good, especially when you're dealing with all that pain and irritation.
Yeah, like a little self-care pampering.
Exactly.
But what happens when all of that, the home remedies, the lifestyle changes, it's not enough? When do you need to see a doctor?
That's a really important question. If you have persistent bleeding, especially if it's heavy, see a doctor. Severe pain that doesn't get better with home remedies, that's another red flag. And if you notice a lump, a protrusion, that doesn't go away, it's time to seek medical attention.
Okay, those are some clear signs that it's time to call in the professionals. But what about treatment options beyond home remedies? What can a doctor do that you can't do at home?
Well, there are a few minimally invasive procedures doctors can do to shrink or remove hemorrhoids. One common one is rubber band ligation. Sounds a little scary, but it's actually quick and relatively painless.
Rubber band ligation. Okay, I'm intrigued and a tiny bit scared. What does that involve exactly?
It's pretty straightforward. They use this special tool to place a tiny rubber band around the base of the hemorrhoid, and it cuts at the blood supply. And then over time, the hemorrhoid shrinks and just falls off.
So it's like strategically choking off the hemorrhoid's lifeline. Interesting. What are some other minimally invasive options?
There's sclerotherapy, where they inject a chemical solution into the hemorrhoid to shrink it. And then there's infrared coagulation, which uses heat to do the same thing.
Okay, so all those procedures are basically aiming to shrink the hemorrhoids without major surgery. But what about those more severe cases? When is surgery the best option?
Surgery is usually for cases where the hemorrhoids are large or they're prolapsed, meaning they're protruding or haven't responded to other treatments. There are a couple of different surgical procedures. Hemorrhoidectomy is the most common, and that's surgically removing the hemorrhoids.
So that's the, like, get rid of them for good option.
Exactly. And it's very effective for those severe cases. But it's also more invasive than the other procedures, so there's usually a longer recovery time. Another surgical option is called stapled hemorrhoidopexy, and that involves putting the prolapsed hemorrhoids back in place and securing them with, well, surgical staples.
Okay, so that's a little less intense than complete removal. But I imagine the best option really depends on the person.
Absolutely. The best approach is to talk to your doctor, figure out the best treatment plan for you. They'll look at how severe your hemorrhoids are, your overall health, your preferences.
That makes sense.
Yeah.
It's about finding the best solution for each individual. But before we wrap things up, let's circle back to prevention. What can our listeners do to, proactively reduce their risk of getting hemorrhoids in the first place?
That's a great question. And the good news is a lot of the things we already talked about, those can help prevent hemorrhoids too. It comes back to those healthy lifestyle choices.
Right, those trusty lifestyle changes. So remind us, what are the key takeaways for prevention?
First and foremost, prioritize fiber. Make sure you're getting plenty of fruits, veggies, whole grains, legumes, all that good stuff.
Got it. Load up on the fiber. What else?
Stay active. Regular exercise helps keep your bowels moving, prevents constipation, which we know is a big contributor to hemorrhoid development.
Okay, so fiber, exercise, and I'm guessing hydration is still crucial.
Absolutely. Drinking plenty of water throughout the day. It's so important for keeping things moving, keeping those stools soft and easy to pass. Aim for at least 8 glasses of water a day.
Hydrate, hydrate, hydrate. It's like the mantra for life. Anything else?
Avoid prolonged sitting whenever possible. So if you have a desk job, get up and move around every hour or so. Even a few minutes of stretching or walking can make a difference.
So no more binge watching our favorite shows for hours on end.
Well, maybe take a break every now and then. Stretch those legs, get the blood flowing.
Okay, good advice.
And finally, maintaining a healthy weight can help reduce pressure on that pelvic area, which, as we know, can contribute to hemorrhoids.
Okay, so those are some great tips. Sounds like a recipe for overall good health, not just for preventing hemorrhoids.
You're exactly right. Taking care of your body, it's the best way to prevent a whole host of problems. And hemorrhoids are no different.
Well said. But, even with the best intentions, sometimes things happen. So let's take a few minutes to answer some common questions people might have about hemorrhoids. Like, imagine we've intercepted some listener questions from the internet.
I love it. Hit me with those questions.
Okay, this first one is pretty basic. What causes hemorrhoids? I know we've touched on this, but it's worth reiterating.
Absolutely. Like we talked about earlier, the main culprit is that increased pressure on the veins in the rectum and anus. And that can be caused by a bunch of factors: straining during bowel movements, chronic constipation or diarrhea, pregnancy, obesity, prolonged sitting, a low-fiber diet.
Okay, so it's kind of a combo of things that can lead to those swollen veins.
Yeah.
What about home remedies? People always want to know what they can do at home to get some relief.
That's a great question. And the good news is there are some really effective home remedies. A high-fiber diet, warm sitz baths, staying hydrated, and those over-the-counter creams and ointments, those can all help provide relief.
Right, we covered those earlier. But when should someone see a doctor? At what point do home remedies just not cut it anymore?
If you have persistent bleeding, severe pain, or prolapsed hemorrhoids that you can't push back in yourself, it's definitely time to see a doctor. Don't wait for things to get worse.
Good advice. And here's a question I'm sure a lot of people are wondering. Can hemorrhoids be cured without surgery?
In a lot of cases, yes. Mild cases of hemorrhoids can often be managed with lifestyle changes, medications, or those minimally invasive procedures we talked about. Surgery is usually reserved for the more serious cases.
Okay, that's good to hear. And finally, are hemorrhoids permanent? Once you've had them, are you doomed to suffer forever?
Not necessarily. Hemorrhoids can resolve with treatment, but chronic constipation or strain can cause them to come back. So it's important to make those lifestyle changes and maintain those good bowel habits to keep them from coming back.
Okay, so it's not a life sentence. There's hope. And that brings us to the end of our FAQ session. I feel like we've covered a lot of ground today.
We have. I hope our listeners are feeling a little more informed and empowered to take control of their health.
Me too. But before we sign off, I want to leave our listeners with one final thought.
I'm listening.
Knowing what we now know about hemorrhoids, their causes, and all the different treatment options, what's one small change you can make in your daily life to prevent them? And to improve your overall digestive health, it could be as simple as adding more fiber to your diet or taking a quick walk during your lunch break. Every little bit helps.
That's a great point to end on. Small changes can make a big difference when it comes to our health.
Absolutely. So to our listeners, take care of yourselves and remember, you don't have to suffer in silence. There's help available and knowledge is power. It's really interesting. We've learned so much about hemorrhoids, the practical stuff, the medical stuff, but I think there's something else we need to talk about.
Yeah, for sure. I think a lot of times we forget about the social and emotional side of hemorrhoids.
Exactly. It's
Yeah.
not exactly something people chat about, at parties. There's a lot of shame, embarrassment, and that can make it harder to get help.
It's true. Almost like a taboo subject, even though it's so common.
Yeah. It's like this weird secret everyone keeps, even though most of us will probably deal with it at some point.
Yeah.
And that just makes the stigma worse. It keeps people from getting the information they need.
You're absolutely right. The more we talk about it, the more normal it becomes, the less power that stigma has. And it's so important to remember, hemorrhoids are a medical condition,
Right.
like any other. It's not about your character or your hygiene.
Such a good point. It's not your fault if you get hemorrhoids, and you shouldn't feel ashamed to ask for help.
Exactly. And, beyond the physical discomfort, there's the emotional part of it too.
Yeah.
People might avoid going out, feel self-conscious. They might even have anxiety or depression because of it.
That's so true. Some of my friends have had hemorrhoids, and they were embarrassed to even talk to their doctor about it.
I get it, but you have to overcome that. Doctors have seen it all. They're there to help you, not judge you.
Exactly. And the good news is there are so many effective treatments out there. You don't have to just suffer.
Nope, you don't. If you're struggling with this, please talk to your doctor. There is no shame in getting help, and remember, you're not alone in this.
And even beyond seeing a doctor, sometimes just talking about it with someone you trust, a friend, a family member, a therapist, can make a huge difference.
It really can. Sharing your experience, connecting with others who understand, it helps you feel less alone.
For sure. So to our listeners, if you're going through this, remember, there's help, and don't be ashamed to get it. Take care of yourself physically and emotionally.
And those healthy habits we talked about, fiber, exercise, staying hydrated, those are good for everything, not just hemorrhoids.
It's all connected, isn't it? Taking care of your body, it's an act of self-love.
Couldn't agree more.
Well, on that note of self-care and breaking down those stigmas, I think we've come to the end of our deep dive on hemorrhoids. It's been fascinating, informative, and I hope empowering.
It really has. We've covered it all. The causes, the symptoms, treatments, even the social and emotional side of it.
We tackled the awkwardness, debunked those myths, gave you the knowledge to take control of your health.
And hopefully a few laughs along the way.
Always good to have a few laughs. Laughter is the best medicine. Maybe even better than fiber.
I don't know about that, but definitely a close second.
That's true. Well, to our amazing listeners, thank you for joining us on this deep dive into the world of hemorrhoids. We hope you learned something new, got some insights, and most importantly, feel empowered to put your health first.
Knowledge is power.
Until next time, stay curious, stay informed, and most of all, stay comfortable.